there is strong public support for the government to address high and rising drug prices, Minnesota Senator Tina Smith, a member of the Senate Help Committee, joins me now to share her thoughts on this front. Welcome, Senator.
Thank you. It's wonderful to be with you.
Well, you have been laser focused on this issue. Actually, the first bill you introduced dealt with prescription drug pricing. So, big picture, what has worked in the past and what needs to be done in the future?
Well, so I start from the place that healthcare should be a right, not a privilege. And the understanding that I've picked up from so many Minnesotans that a lot of people struggle to pay for the prescriptions that in some cases they need to stay alive. I mean, the numbers are really, as you know, incredible. Many people are rationing their medicine because they can't afford it. And at the same time, prescription drug prices are going up and up and up. I think they've, tripled in the last, chunk of time. So this is obviously a big problem that we have to solve. And that's why the first bill that I introduced was to go at how can you bring more competition and more price transparency into the prescription drug market in order to have consumers be able to afford the medicines that they need. One thing that happens is that you have basically the big name brand drug companies kind of gaming the system. They have patent protections and they game the system in order to protect those patents, and that allows them to protect their capacity to charge Americans many, many, many times higher prices than they get other places in the country. That's something that I think we should be able to go after and we should be able to fix, and there's bipartisan support for that.
And are you optimistic, speaking of bipartisan support, in passing any legislation, if you bet that the bill's not going to make it, you're right 99% of the time. We are in divided government now. There has been some healthcare legislation in recent years, whether it's the Right to Try Act or the 21st Century Cures Act, which actually was bipartisan. Obviously, the Affordable Care Act was not bipartisan. But what do you think can be done, and what is on the Senate Health Committee's agenda this Congress?
Yeah, well, so a couple of observations. One is that the Senate Health Committee has traditionally worked in good, strong bipartisan ways on some on prescription drugs and worked in bipartisan ways on mental health and supporting community health centers. So, you always have to look for that place where you can find common ground and you can reach some accommodation. And many of the bills that I've introduced to bring more competition into prescription drug pricing are bipartisan bills. I've worked with Senator Cassidy and Senator, who's now the ranking member of the Health Committee, and Senator Marshall and others. So, I think you have to be optimistic. One other thing I'll just observe is that though the Inflation Reduction Act reforms that bring more competition to prescription drugs for seniors and are going to lower premiums for seniors and cap prescription drug costs for seniors, set the price of insulin at $35, no higher if you are on Medicare. That may not have gotten any Republican votes in the Senate, but it's broadly bipartisan out in the real world of Minnesota and other places in the country.
What can we learn from other countries? Because in this country, we're paying the highest drug prices, but that's not the case across the globe. What do you think we could learn from others?
Well, what happens in the United States, because we've just failed to do some basic things like allow Medicare to negotiate for better drug prices. American consumers end up paying the premium and are in some ways subsidizing the more realistic and reasonable prices that folks around the world are paying. And, there's often an argument made that what we're doing is we're paying for innovation and we are paying for research and development, and to a certain extent, of course, we want to a certain extent, there's like a fraction of truth in that. Of course, we want to encourage innovation and new technology. But the reality is that if you look at the budgets of these big prescription drug companies, they're spending way more on marketing and sales and lobbying than they are on research and development. And lots of their research and development is already subsidized by American taxpayers through the NIH and other base research that we do in this country. So one thing I think that we can learn from other countries is let's allow a broader negotiation for prescription drug prices. We made some really important steps with the Inflation Reduction Act. I'd like to see that go faster and be able to negotiate the prices down on more prescriptions more quickly. But even what we passed just with Democrats will start to make an improvement. And of course, what happens is because Medicare is such a large market, lower prices in Medicare start to put downward pressure on prices across the board, even if you get your health insurance through private insurance or the ACA or other sources.
Right. The President Biden has said and highlighted all that was done in the last Congress, and after a lot of fits and starts, there was a fair amount of legislation that surprisingly got through in an election year. I was skeptical that some of those bills would get through. They did. However, the messaging, some Democrats say, is not there. Whether it's drug pricing in the Inflation Reduction Act, is it very important to remind people what Democrats did? Because whether it's the transportation bill or the IRA, it does take time for it to get to consumers and that they feel the difference. But is that important over the next year and a half before the next election to say, this is what we did and this is how it's going to make your life better?
I think it's very important. And it's important, yes, one, because, we want to win elections, to be,
Sure.
Totally honest. But it's beyond that because, Americans need to be able to see and understand that their government is delivering results. It is solving the problems that they have asked us to solve. In a world where there is so much noise and there's also, honestly, so much misinformation, we have to do our work to make sure that people understand. And, here's an example. With the Inflation Reduction Act, we put a $35 cap on insulin for people that are on Medicare. And we also said that all vaccines, if you're on Medicare, vaccines for the shingles or for COVID or other vaccines are going to be free. Now, that is a really significant benefit for folks on Medicare who struggle to pay for their prescription drugs, but it's going to take a while for them to feel it. They'll start to feel it, and then we need to do a much better job of communicating what that benefit is and helping people to understand and connect the dots. And it's no shame on them. People have busy lives. They've got a lot going on, and it's hard to keep track of this, particularly when there is, as I said, so much other news and so much happening in people's lives.
Earlier, Senator, you mentioned lobbying, and there's a lot of lobbying in healthcare, and I don't think lobbying is a bad thing. Teachers have lobbies, and policemen have lobbies, but it's pretty intense in the healthcare field, which I used to cover. What has surprised you about coming to Washington and trying to get stuff done amid the massive lobbying in healthcare, where providers sometimes join up and back a bill, and a lot of times they're at odds with one another?
Well, I think that it's a really interesting question because I will tell you that I know and trust and respect some of the folks that lobby for health plans or are in healthcare. And the best of them will give you full information, will tell you the pros and cons. And of course, that they have a point of view and that they're, what they're trying to get done. And that should be transparent and clear. But what happens is that you have big, powerful lobbies like pharma, for example, or like the gun lobby that kind of succeed in locking down the important policy changes that we need to make. And then it stymies progress and it frustrates Americans because they don't understand why we can't make the progress that we need to make. It's nonsensical to them. So you have to be willing and able to buck that and to do what are right for your constituents, and not just what you are hearing from the folks downtown, as we say here in Washington, who are also, candidly, the folks that are making big financial contributions on the other side to legislators in order to have their ear and influence them.
What can the administration do? After a bill passes, there's implementation. We're seeing that with a number of bills. But whether it's FDA or CMS, FDA approves the drug, but then it's got to be reimbursed, and then there's patent. It's all very complicated. I know a lot of consumers are just frustrated. They don't understand their health care bills. But what can the administration do? What do you want the administration, whether it's various agencies, on implementation of legislation or things that they could do to make quality of life better?
Well, the reality is that we all every day in my office are in close touch with the administration to keep an eye on how implementation is going, push them along if we don't feel that they're going fast enough, try to help them understand what impact this is having on people in Minnesota so that they can be more responsive. These are big, complicated federal agencies. And I mean, honestly, sometimes they get stuck in their ways. They have certain ways of doing things, and they need a little push to be able to move along. I know from my conversations with the White House and with the president that he is determined, he is hell-bent, for example, to make sure that the implementation of this drug negotiation with Medicare, that it goes as quickly as possible. Frankly, we all would have liked to have done more than that, but we weren't able to get the votes for it. So I think in his budget that he's going to be announcing on Thursday, today, that we expect him to be proposing additional reforms that will also make headway. So it's a process, and it's not like you don't get everything done all at once, but you have to keep working on it and be optimistic about what you can accomplish.
Senator, last question. You mentioned the Inflation Reduction Act, and obviously that was a trimmed-down version of Build Back Better. If Democrats, and you mentioned the election, do well, and then the House and Senate and White House are all up for grabs, but if Democrats were able to get everything, do you think, and would you want Democrats to pick up some of the stuff that got on the cutting room floor of Build Back Better and pursue that again in a couple years?
Absolutely. I mean, here's a classic example. We were able to get through in the Inflation Reduction Act that cap on insulin at $35 for people on Medicare. We wanted it to be a cap on insulin for everyone. We were blocked from including that in the legislation. Although we had bipartisan support, we had Republicans that voted for it, just not quite enough. More blocked it. That's a classic example of something that I'd like to see us do. And I just want to note also that even though we weren't able to accomplish that $35 insulin for everyone, you can already see the pressure that we are putting on big manufacturers like Lilly, who have announced that they're going to move their price to that level as I think, a response to the outcry that people are, the outcry that you see around insulin prices.
Senator Smith, thanks so much for joining us. We appreciate your perspective.
Thank you so much.